We have in with us from Prairie Links Hospital, Dr. Kalaga. How you doing this morning, sir?
I'm doing very well. Thanks for having me.
Yes.
Well, wonderful. We appreciate you coming in here today. And today our topic is peripheral vascular disease. And I got to first of all say, what does that mean?
I didn't really know what it meant either.
Peripheral vascular disease deals with blockages in the arteries of the body, in the peripheral parts of the body, mainly the legs, the arms, the neck, the carotid arteries going to the brain. And also it encompasses the blood vessels in the abdomen too. Blood vessels going to the kidneys and blood vessels going to the bowels. Blockages in any one of these blood vessels is called peripheral vascular disease.
Okay. Is this pretty common?
It is very common.
Okay.
Unfortunately, it is not recognized as commonly as coronary disease of the heart, but it is getting increasingly recognized now as a big player.
Okay.
Yeah, normally when you think of a blockage, you always think of the heart.
You do, yeah.
But what are some of the symptoms of this disease?
It depends again on the location of the disease. If it is the carotid arteries going to the brain that are blocked, you can get a mini stroke or a major stroke, or some other symptoms relate, for example, sudden blindness or blackout sensation in the eyes and dizziness. Those are some of the symptoms pertaining to the carotid arteries. But if it is arteries pertaining to the legs, which happens very commonly in patients who smoke, long-time smokers and diabetics, it causes a lot of pain in the legs when they walk.
Okay.
And we call it claudication pain, and that's one of the major symptoms. And in some of the people with diabetes, long-term diabetics, they can get sore spots on the feet or the toes that don't heal. Normally, if you get a sore spot on the toes, it heals in 1 or 2 weeks with good treatment. But these spots, these ulcers, we call them non-healing ulcers. They don't heal, and they can persist for a long time. And if they persist for a long time, they can get infected, and that can endanger the foot, the toe, or even the leg sometimes.
Is this fairly easy to treat, or what are some of the treatments for this?
It is easy to treat, but there are some potential pitfalls involved in the treatment itself. First of all, we have to diagnose the problem, and then diagnosis is a big player because a lot of these patients don't have any symptoms to begin with. And when the symptoms occur, it is fairly late in the game. So it needs to be recognized by the physicians who are treating these patients, not just the cardiologist and the vascular people, but also the primary care physicians and the podiatrists who see these patients most often. They need to recognize that patients who smoke, who have high blood pressure, high cholesterol, patients who have coronary disease, and patients who are diabetics, they could have peripheral vascular disease also, and they should start investigating these patients even if they don't have any symptoms, so you can diagnose the problem early and then get good treatment.
Do you find a lot that sometimes it is a person that has a stroke and that's how you figure it out, unfortunately?
That's correct.
Yeah.
And then I get a lot of patients referred to me with ulcers on the feet that are not healing. And then when I start investigating with all kinds of studies and tests, I figured that there are a lot of blockages in the legs, in the arteries of the legs, and then I go and do angioplasty and open those blockages and to restore blood supply again to the legs and the feet so the ulcers heal.
Do they feel immediate recovery or immediate relief, I should say, after something like that?
If somebody comes to me with peripheral vascular disease with severe pain in the legs because of the blockage, they will have almost immediate relief from the pain.
Okay.
This goes to say we should probably be getting in for our annual checkups.
Correct.
That's correct.
Yeah.
And we always go by the risk factors a patient has. For example, just like the risk factor somebody has for coronary disease, high blood pressure, high cholesterol, diabetic, smoking, age, and all that, the same. A lot of those risk factors, they also are applicable to peripheral vascular disease, where you have to start investigating.
Let me ask you this, too. If you've had this problem and you get it resolved, can it come back again?
Yes, it can, because the risk factors don't go away. Because a patient who is a diabetic for life, hypertensive is a hypertensive for life. Age always goes only in one direction, north. It doesn't go south.
Yes, definitely.
And so when there are risk factors which you cannot really modify, and they're playing a role in causing these problems, you have to be always on top of your game.
Absolutely.
Well, this was very informative.
Very good.
Yeah,
Yes,
thank you.
Thank you. So Prairie Lakes Healthcare, obviously, if you're having any of these symptoms, like we said, if you're having the issues with your feet or something, get it checked out. Don't wait.
Get it checked out,
Yes.
and I do a lot of angioplasties in the legs and other places in the body.
Sure.
In addition to coronary, artery blockages.
Okay.
They should definitely to Prairie Lakes Hospital to get checked out.
Dr. Kalaga, anything that we're forgetting here? Think we got covered?
We got covered.
Perfect. Tell you what, you did a great job. We learned a lot today. I at least did. Thank you. We sure appreciate it, okay?
Thank you very
All
much
right.
for having me.
Take care. Have a good rest of your day, sir.
You too.